Hello, my name is Christine Franzese. I'm a professor in the Department of Otolaryngology and Head and Neck Surgery at the University of Missouri in Columbia, and today we're going to talk about the prevalence and epidemiology of chronic rhinosinusitis, both with and without nasal polyposis. So let's get started. First, let's take a closer look at my disclosures. I do have some relevant disclosures for chronic rhinosinusitis without polyposis, but none directly relevant to this lecture. And today we are going to discuss and quickly review the prevalence and epidemiology of our most beloved disease, chronic rhinosinusitis with and without nasal polyps. So, of course, we have the perfunctory definitions that we start with, just so that we're all on the same page. Whenever we're talking about epidemiology, we're specifically referring to a branch of medicine that deals with the incidence, distribution, and possible control of different diseases and other factors related to health in our population. Now, specifically for incidence, this is defined as the occurrence of new cases of disease or injury in a population over a specified period of time. Prevalence refers to the proportion of persons in a population who have a particular disease or attribute at a specified point in time over a specified period of time. Prevalence differs from incidence in that the prevalence includes all cases, both new and pre-existing. And in this current pandemic era, I'm sure we're very familiar with or have heard those words before. So let's move on a little bit. So chronic rhinosinusitis with and without nasal polyposis. Overall, chronic rhinosinusitis is thought to be very common, but the prevalence is difficult to measure. Why exactly is that? Well, you'll learn more about this in our course, but it requires some clinical objective physical findings really to diagnose it, and that's difficult to do in an epidemiological study. Because the diagnosis includes both subjective and objective confirmation, that makes it difficult, and most epidemiological studies do not distinguish between chronic rhinosinusitis without polyps and chronic rhinosinusitis with polyps, but that lump those two diseases together in a whole. So let's take an example of why this potentially may be somewhat difficult, and why endoscopy and learning how to use it can be very helpful. So let's have an example of this patient you see in your clinic, and if you just did anterior rhinoscopy, you may see the nasal septum as you do here and the turbinates. You may not get a really good view as to what's going on, and again, some of the symptoms, which we'll go over in our course, nasal congestion, loss of sense of smell, or decrease in sense of smell can be common or possibly due to other causes. So confirming this diagnosis with an objective finding is very helpful. So let's take a look at this. Now, this is an endoscopic view using a flexible scope, and this person has had surgery before because you can see an adhesion between the middle turbinate and the lateral nasal wall. But as we get closer to the maxillary sinus on the left side, you can see this whitish purulence coming out of it that wasn't really obvious in the anterior view. And as we go into the sinus, we see this thick white purulence. Again, an objective finding that confirms our suspected diagnosis in this patient, but not necessarily easy to see from anterior rhinoscopy alone. So with CRS, just looking at the symptoms alone, in the United States, the prevalence is estimated to be anywhere from 2.1% to 13.8%. That's quite a range, but again, if you don't have objective findings to confirm the diagnosis, that sort of tends towards a larger range. An analysis of ICD-9 codes in Pennsylvania found that the average incidence of chronic rhinosinusitis without polyposis to be 1048 plus or minus roughly 48 per 100,000 person years, and two epidemiologic studies using radiographic findings suggested a prevalence anywhere from 1.7 to 8.8. So again, a little tighter range there. As we look at the prevalence of CRS worldwide, in Europe, it's reported that there's a range anywhere from 6.9% to 27.1%. Again, that's a huge range. In China, there was a study of over 10,000 participants who were surveyed in 7 cities that reported a prevalence ranging from almost 5% to close to 10% depending on the city. And in Canada, there was a population-based analysis of ICD-9 codes where the incidence of CRS was found to be 2.3 to 2.7 per 1,000 people. So when we look a little closer at the estimated prevalence of chronic rhinosinusitis, we'll dig deeper into this in our course, but you'll notice we have it broken down by the different flavors as well as overall. And you can see, depending on where you are in the world, this may vary, but overall, chronic rhinosinusitis without nasal polyposis is more common than with nasal polyposis. And you can see here the different inflammatory subtypes, which again we'll go into further into the course. Looking specifically at chronic rhinosinusitis with nasal polyps, and going back to Europe, in France there was a study of 10,000 subjects who were screened by questionnaire. 2.1% of those were identified as having nasal polyposis by this questionnaire. In Finland, there was a survey of over 4,000 adults that found that 4.3% reported having been diagnosed with nasal polyps, but the problem with this is the lack of objective confirmation of polyposis and the risk of recall bias. There was another study in Denmark looking at the incidence of chronic rhinosinusitis with nasal polyposis, and it was estimated to be at 0.627 patients per 1,000 per year, with an incidence that was slightly higher for males than it was for females retrospectively. There was also a population-based analysis of ICD-9 codes from patients at the Geisinger Clinic for about 2 years, with the incidence of chronic rhinosinusitis with nasal polyposis was about 83 cases per 100,000 person years. In Sweden, there was a patient cohort study of about 1,300 patients. It was found that about 2.7% of those were found to have nasal polyps on actual nasal endoscopy. So now we have a study with some objective physical findings, the ability to objectively confirm something. This becomes a little more interesting than when we look at this Korean National Health and Nutrition Examination Survey that also used nasal endoscopy. And they found over a 4-year period that the prevalence was 2.6%. But interestingly enough, when you look at autopsy specimens where you can really confirm physical findings, it's estimated that there's 26% to 42% of autopsy specimens that contain nasal polyposis. So I want to thank you. This was just a really brief overview of the prevalence, the incidence, and epidemiology of chronic sinusitis with and without nasal polyposis. Here are my references, and I hope you enjoyed this lecture.